GAD is actually a somewhat controversial diagnosis these days. Everybody agrees it exists, but whether or not it exists in a very high percentage of individuals versus a much lower percentage, previous data 20 years ago were showing it at 2.2%. More recent data in Norway, a place known for extremely good health outcomes, I will add, and has a very healthy populace, had rates at 4.51% in 14-year-olds even. And so, I think a lot of people are saying, what's actually going on with this in the US? If you talk to the average 16, 17, 18-year-old, the number of them that are up late at night, having problems with irritability, muscle stiffness, trouble sleeping, headaches, stomach aches, being on edge because they're worried about what college they're going to get into, what their grades are, if they can provide enough for themselves, if they can buy a home in the future. I think it'd be very hard to say that that number is anywhere resembling 2% anymore, but it is just not well studied in the US. Again, all of you know GAD symptoms. I'm going to blow right past that and talk to you a little bit, what happens when you're feeling like that all the time, right? You're worried about the future, you're worried about global warming, you're worried about being liked by your peers, you're worried about your parents' expectations, right? Our current teenagers are the first generation in the history of America to be born to parents who are doing worse than their parents, right? And so they get parents that say, you got to do this. You have to get that grade. You have to get it into an Ivy League school in order to secure your spot in this increasingly competitive landscape. And anybody who frankly tells you that it's not getting increasingly competitive in this country is just lying to you. And so this is not anxiety based on arbitrary things because 17-year-olds are getting irrational. This is based on real data and what's actually happening in the world and the experience of them coming from their parents' generation, frankly, my generation. There are going to be issues with sleep, concentration, irritability, fatigue as a result of these anxieties. And frankly, nobody really wants to spend a bunch of time with somebody who's known to be really anxious and on edge all the time, right? So what do kids do? It was going to show you about the role of central nervous system depressants in helping kids feel like they can be normal, that they can be chill, to not feel that being on edge all the time. This is one study to show that. I apologize, I was missing a slide in there, of a 2011 Finnish study, so this is already a decade plus old, but taking a look at thousands of adolescents again, and these are in Norwegian countries that have unified healthcare systems where they can really get perfect population data. They were taking a look at GAD in early adolescence, and in those instances it preceded the substance use of alcohol and cannabis, and they did a whole bunch of stuff to control for confounders. GAD use prior, when they're catching these kids early, increased the likelihood of alcohol use by threefold, 300%. Right? And those that had GAD and then went on to use alcohol were more likely to continue to drink than those who didn't have GAD in the first place, which means, of course, that when the substance actually is solving a problem that you have in your life, it's not solving it, but it's improving it for a few minutes, few hours, you're more likely to go on to use it, right? This is evidence of the self-medicating, description being an actual thing that is what's literally going on, right? The same things exist for cannabis, although with GAD, because it's understudied, I don't have great data to show you, but certainly we know that the central nervous system depressants, principally alcohol and marijuana, are used much more frequently in adolescents who are struggling with both generalized and social anxiety. Separately, I think OCD is an area that doesn't get touched on enough for this too, because for kids who are suffering with severe obsessive thoughts, alcohol and cannabis can feel like the only way forward. And so we certainly see patients that fall into that bucket as well. I wish I had better studies for you, but I hope you can take my word for it. That's certainly the case.